I'm happy to be here. Thank you so much for this opportunity. I'm 72 years young, and I have had a very rich and blessed career in nursing. I started out as a diploma nurse in Philadelphia at Jefferson, and according to prior Dean Karshmer, I was one of the first diploma grads they accepted into the master's program here. And 2010, I received my MSN with the clinical nurse leader specialty. And in 2013, I earned my doctorate in nursing practice in healthcare systems leadership. So I'm very grateful to USF. I believe that the relationship between a student and their teacher is priceless. And if it turns into a mentorship or coaching, which has many times with many of my students who are now planted all over the Bay Area in very good jobs, it's very gratifying. It's very gratifying. And leaving our students with much more than just an education, but leadership skills and a multidimensional sense of their self and the world. My career spanned graduating from a diploma school at Jefferson in Philadelphia. Then I went into the emergency room nursing. Then eventually I went into my love, which is oncology nursing. And I began to subspecialize in breast oncology and developing breast centers around the country, comprehensive breast centers within cancer centers in many different settings. So my connection with oncology is always there. And I would say my national reputation prior to coming to USF was really focused on networking related to comprehensive breast center development and how to increase the quality of care across the continuum from prevention through home care, palliative care, and hospice care. So I keep connected to oncology, but I think probably the aspect of quality, safety, and performance improvement since the last 10 years prior to my doctorate was spent at a Medicare quality improvement organization funded by the government, and it was focused on quality. So I kind of segued from oncology after 30 years into quality, segued from oncology into quality and performance improvement in mammography screening, in cultural diversity, in electronic health records, which were happening at the time. Absolutely. My favorite courses to teach are the practicums and the internships. And I've even served on many doctoral committees for students. I've chaired a few, and incredible nurses that we graduate. I have one graduate who's up at UCSF running the whole outpatient neurology center, and he's fabulous. Also, I've published with some of my students, one of whom was a CNL student in the MSN program and then as a doctorate. And she went on to become a director of nursing at USC Keck. And now she's back up in the Bay Area in Kaiser, and she published. And it also surprises me that more nurses don't want to publish and write to share with their colleagues in journals, nursing journals or interdisciplinary journals. They're afraid of it. So I think we should, help develop and empower them and teach them the skills and utilize resources like we have here, the Center for Writing and Learning, and, encourage that, that I think that's empowering to us as a profession. Publication of sharing of things that work and even things that don't work. Failure can be a major lesson learned. I think it's really important that we share that way and in many other ways. And it's exciting because when I was in Clinical Journal of Oncology Nursing editor, there's blogs now and there's videos and there's YouTubes and all kinds of things that we can do to help publish and disseminate, which is the final step of evidence-based practice, to disseminate nursing findings, whether it's quality improvement, which is usually exempt from an IRB, or whether it's pure, rigorous, quantitative or qualitative research. And I'm involved in a couple of studies in both. And of course, in my MSN students, they're all quality improvement, because that's really my subject expertise is quality, safety, and performance improvement. Now, with a strong background in oncology and breast care. The aha moments: listen to your intuition, remember them, carry them forward as a nurse into your nursing practice.